Hey guys, welcome to A Day in the Life. Today's topic is Men's Health is coming over to film a journey on how to optimize your overall health by starting in the mouth. I'm Dr. Dominik Nischwitz, specialist for biological dentistry. And yeah, I can't wait to show you everything. We will start with basically the Men's Health editor-in-chief has a biohacking sequence in his magazine, and he learned about the oral health as part of the overall body, which is usually missed. And we will use him as a patient, do a cone beam scan, discuss this in the clinic, and then do all the other scans we do. Basically a complete patient's journey, but then also look into a little bit what we're doing on it, what I am doing on a daily basis, how I hack my life, or how I use biohacking or health optimization to stay young and fresh, even though I'm a dad of 4, having a clinic, another clinic, and a couple of companies. Yeah, just so you can be inspired and learn how to be successful and do it too. So enjoy, guys. So nutrition is very, very important for me and all the patients here. So this meal number 2, the first ingredient is always some sort of a protein. I like animal protein. Today it's shrimp. And I'm shooting for about 2 grams per kilogram ideal body weight, or 1 gram per pound of protein. I weigh about 185 grams, weigh 185 pounds, so I eat about 185 grams of protein a day. For my energy source, I picked carbs today. This is a simple white potato, and then there's a tiny bit of asparagus in there. So basically, the message is eat real food, guys, because optimal health starts in your mouth, and this is for digestion too. And you get the right nutrients, the building blocks, the energy blocks to sustain for surgery, mental clarity, performance, just for optimal health, right? Keep it simple, guys. Yeah. Okay, Men's Health is here. Let's go down there. Okay. Hey.
Wunderschönen guten Tag.
Was geht ab, Nico? Alles klar?
Alles super. Und bei dir?
Freue mich, dass du da bist.
Ich freue mich auch. Ja, ich bin ganz gespannt, was mich heute hier erwartet. Ich habe es gerade schon angekündigt. Ja, es wird ums Thema biologische Zahnmedizin gehen und du bist da der Experte schlechthin.
Genau, wir gucken, was wir aus dir noch rausholen können, indem wir im Mund beginnen. Der Teil, den man immer übersieht. Ja? Aber der Eingang zum Körper. So, Nico from Men's Health, he basically does the complete patient's journey here. So we're starting with the more dental examination. What we need is a panoramic X-ray, 2-dimensional one, as well as a 3-dimensional X-ray called cone beam. Why? Because I always ask 3 questions. Are there any metals in your mouth? He said no. Any root canals? He said no. But I also ask, did they pull your wisdom teeth? And he said yes. So then I know there might be something called cavitations in layman's term, called NICO, FDOJ. So we'll check this, because then later we go up and examine his cone beam, his clinical status, just the biodentistry intro part, before we head over to the Optimal Health Lounge to scan with bioresonance and to do an in-body scan to see his body composition. Because even though we're at a dental office, we're doing biodentistry 3.0, and that means we are overlapping or melting or fusing the high-tech dentistry, which focuses on biocompatible materials, with functional medicine and health optimization, or for him, biohacking is the same, just to see how we can optimize even more, with the goal of making you as healthy as possible by starting in the mouth, to basically live as long as possible, but stay as young as possible. So basically, I asked Nico 3 questions, and he answered no to the root canals and no to the metals. But then after seeing his panoramic X-ray or 3-dimensional X-ray, we realized there is a root canal. And this happens often because a root canal treated tooth maybe was painful back in the day, but you forget about it, and then you still have something dead in your body. So that's good. And then I asked him, because that root canal is on the meridian for the stomach, and I asked him, he's quite optimized, maybe you have a knee pain. And he said, oh, yeah, maybe that is the case. So we also looked into cavitation sites where it is wisdom tooth pulled, so there is a cavitation. We also found a cavitation behind his wisdom tooth. Is also interesting. 10,000 years ago, all of us had 2 sets of wisdom teeth. We had wider jaws, we had space for them, we ate harder foods, had to chew more. So some people still have the dental bud for the second wisdom tooth, and if that doesn't grow into a tooth, it's kind of like tissue in your bone becomes the perfect cave, again, for cavitations in layman's terms. So what I'm doing next is I showed Nico the tooth meridian chart and marked the root canal as well as the problems. And we will use a neural therapy, which is just basically an anesthetic, Procaine. It's called neurotherapy. And Procaine dissolves into 2 parts. One is anti-inflammatory, one brings blood. Kind of like a reset to his nervous system. And then because he's very sensitive over his body, because he does a lot of sport, usually athletes are more sensitive over their body, myself too, then you feel, because you know exactly how you move. For 24 hours he just feels and has kind of like an initial diagnosis of what would happen if we did a surgery, which we will do at one point probably. An den Scans. Ja, die Scans sind halt geil, die machen wir aber dir gleich. Kann ich initial sehen, das ist besser als jeder Blutwert. Das ist natürlich auch wieder schulmedizinisch nicht akzeptiert, weil es ist ja Resonanz, aber Frequenzen, sagt schon der Nikolaus Tesla, ist, wie die Welt funktioniert, oder?
Spannend, ja. Also das wäre mal eine Frage gewesen. Also ihr wisst das durch diese Messung, die wir gleich machen? Macht keine Blutanalyse in dem Sinne?
Wir machen auch viele Blutanalysen. Okay, die machen wir jetzt nicht zwingend für die OP, das kommt dann meistens danach. Ja, weil jetzt, also das gesamte Konzept, bevor du behandelt wirst, kriegst du das Ernährungsdesign. Das fängst du an, deine Ernährung zu ändern. Da können wir nachher drüber reden, während wir essen. Unbedingt. Wie funktioniert das? Also die Patienten bereiten sich meistens 4 Wochen mindestens schon mal vor, indem sie ihre Ernährung umstellen und die richtigen Nährstoffe einnehmen. Das nennt sich Bone Healing Protokoll. Und dann kommen die hierher für die gesunde Health Optimization Week vielleicht. Wir machen das, was wir gerade gesagt haben. Und das beinhaltet Störfelder entfernen, Metalle raus, tote Zähne raus, Nikos raus, Keramikimplantate rein und all diese Treatments. Das ist die größte Entgiftung, die man jemals machen kann, in einem. Geht ihr rein? Hi. Carla oder Dani machen den Rest. So. Nico is now in the Optimal Health Lounge. So this is the complete new patient's journey. I personally don't do the new patient's journey. We are a complete team. We have myself as a surgeon, we have Dr. Bene, we have Dr. Noah, we have Dr. Tania, we have my dad. So we have 5 dentists doing all this. So don't expect to see me all the time. But what we do is doesn't even matter, but first we do the dental examination that you just saw, where we just focus on the mouth, the x-rays, the 3-dimensional x-rays, maybe the neural therapy, seeing your initial dental work, the dental repair you've done. Then go into the Optimal Health Lounge, where we do a global diagnostics, a whole body scan, an in-body scan, which is kind of like a DEXA, meaning we look at your body composition. Because what we're actually doing is we're optimizing the overall body by starting in the mouth. And every single patient, before they even see us for that week, they go through my nutritional food design concept. Starting a month prior, they start the bone healing protocol, which is based on the micronutrients, high dose of vitamin D3. And all these things is Biodentistry 3.0. It's the concept of fusing high-tech dental skills with functional medicine and health optimization or biohacking. And therefore, ever since 2024, I have my complete teachings of the last decade. I've built into a online course called Biodentistry 3.0, where I created a new tribe of next level dentists. I call them the real Bs, the real biodentists. And it's starting to spread. So every 8 weeks roundabout, we accept 10 new dentists, open-minded dentists that want to become real Bs internationally. It's in English. And then we do the software update, which is learning all that, how to make yourself obsolete and how to use nutrition, how to use supplementation, all these things to further help patients, next level of dentistry. And then you can come in as VIP. You have seen that probably already when Dr. Nate came in and Dr. Jigger. So yeah, that's the future. And I think it's a dental evolution. We are upgrading into being real doctors. And yeah, it's just a fulfilling part to help patients heal overall. Because the dental part, the dental repair, this is something you cannot biohack yourself. Most dentists don't even focus on that because it works for biting. That's why we need the next level, the real Bs. Check it out. This is stacking biohacks right there. So Nico is here for the journey, and right now he's on the global diagnostics, running a therapy. You see that on these. Then he gets the medical laser photobiomodulation intravenously, And then because of his scan, I knew exactly what kind of nutrients his body will crave. So we knew activated B vitamins, he needs a lot of amino acids, he needs everything for his adrenals and oxidative and nitrosative stress. It's all in that cocktail. And laser. And in biohackers fashion, we are using the time efficiently and doing an interview situation while he is hooked up on everything. I could hook up myself too, but I'm good actually today. So he enjoys everything.
I really do.
Perfect.
Yep.
So very important, as you guys know, is nutrition. Food is medicine. So we are here right now having a late lunch because we had him in the clinic, and we're now preparing for the next part, which is him putting me through one of his full body workouts. So we need to be fueled. I'm a big fan of, that's traditional food. It's also real food. Is a pho. Vietnamese food is basically bone broth, like cooked for 48 hours or even more with a little bit of good beef in it.
Looks delicious.
You should smell it again. And then he has some, what's that? Summer rolls, right?
Yeah. I think it's called summer roll.
What is in it?
There is chicken, and of course not fried, but chicken and shrimps.
Exactly. What is the other roll?
Spring rolls.
Spring rolls. Don't eat spring rolls. They're always deep fried. They might taste good. I don't like it, but these are way better. It's just rice paper, and you can have that with tofu, or in this case, it's shrimp and chicken, a little bit of rice.
And we are having some carbs right before the training, right?
Yes. Yeah, exactly. So carbohydrates is one energy source, actually the preferred energy source of the body. Some people do well with it, some not so much. I mean, there are healthy carbs, not so healthy carbs. I find that white rice is very good actually for fueling a training. Or I also always bring my own food because I never know what's for lunch. So that's potatoes, shrimps, white potatoes, sweet potatoes. That's the good stuff. It fuels you. And as an athlete, I like to eat a bit more carbs. Depending, like we talked about it. We're both kind of had touch points with Charles Poliquin back in the day. So I did a biosignature course way back in the day, like 2010, and he always said carbs you have to deserve, something like this, and I think it's correct, right?
Carbs, right?
Earn your carbs. That's what he said. Yeah, earn your carbs. So we will earn it, pre and post.
Alright, wie ihr seht, befinden wir uns jetzt in einem Fitnessstudio. Ja, eigentlich ging es heute um Zahngesundheit, aber du weißt, wo die Zusammenhänge sind. Vielleicht nochmal in deinen Worten ganz kurz, warum jetzt hier, wenn wir eigentlich über Zahngesundheit und allgemeine Gesundheitsoptimierung sprechen.
Ja genau, wenn wir über allgemeine Gesundheitsoptimierung sprechen, darf man eben Bewegung nicht außen vor lassen. Ich sage ja immer, Emotion comes from motion. Persönlich trainiere ich 4-5 Mal die Woche auch selber, also 4 Mal auf jeden Fall, er ja auch. Und wir messen ja auch diese ganzen Körperzusammenhänge, und die Muskulatur ist tatsächlich auch medizinisch gesehen einfach so eine Art Speicher für eure Aminosäuren, macht euren Stoffwechsel schnell, hält eure Hormone hoch, ist nachher gut, um insulinsensibel zu sein, also Kohlenhydrate besser aufzunehmen. Ist tatsächlich ein Langlebigkeitsorgan. Da gibt es auch immer mehr medizinische Studien zum Beispiel dazu. Insofern, schweres Gewicht bewegen gehört auch als Zahnarzt dazu. Auch wenn man so klein arbeiten muss man trotzdem auch Zähne reißen. Nur Spaß. Aber wir brauchen schon auch Kraft, oder? Ja.
Genau, das machen wir gleich. Und der Dommel hat sich entschieden, tatsächlich in meine Routine anzupassen. Ja, wir werden heute eins meiner Ganzkörper-Workouts durchlaufen, was ich gerade selber auch durchziehe regelmäßig. Und ich glaube, du lässt dich einfach drauf rein.
Ja.
Gibst Gas.
Genau, jetzt ist er der Chef, vorher war ich der Chef. Ich bin einfach der Soldat. Und ja, schauen wir mal, was passiert.
Durch, wird auf jeden Fall Spaß machen. Und wenn ihr das Workout nachmachen wollt, dann natürlich auch alle Infos dazu für euch. Bis gleich.
So now we're in the gym doing Germany's men's health fitness expert, fitness trainer, workout, full body. And the funny part is, this guy is my dad. My dad is also working on his mobility and strength. He's a bit older generation, old dentist, bad hunchback and pain, so he's after it, and he's already 67, so no excuses, guys. So this was a great day having Nico here in the clinic in the Optimal Health Lounge.
Thank you so much.
Yeah.
My pleasure.
Basically, patient's journey of what we do and how we optimize the overall health, and then we finished strong here in the Kraftmanufaktur. Basically, he put me through his workout, which I'm not used to, like full body, new exercises, but he said it was good. He can see the athlete.
Very good performance.
Yeah, so I think if we're athletes from like childhood, it's quite easy to adopt. We were discussing about this, that some people in our age especially have very much difficulties to learn new patterns, right? To learn new exercises. But I'm happy that this worked out. And then at the end I beat him in the grip strength. Yeah!
Strong forearms.
Right here. Strong forearms. Sehr good. But it was a great day. So
It was a blast. My pleasure, really.
I think we probably do another round. We will meet each other at, like he is going to have the Biohacker retreat, is that?
Yes.
So for anyone following from Germany or Europe, I don't know if it's going to be in English or only German?
That one is going to be in German
Only?
which is
Okay.
going to be on the island of Sylt. Beautiful place in the northern part of Germany. And then next year we will do an English one as well.
Ah, cool.
But that will be in 2025.
So I'm also going to speak at his summit. It's 21st and 22nd of September in Sylt.
Yes.
I have personally never been to Sylt, so I'm very much looking forward to this. And yeah, it's all about co-elevation and bringing the complete part to optimize together, right?
Exactly. Thank you so much, John.
Again, cheers, bro.